Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Dr. Anthony, thank you so much for joining us.
Well, thank you once again for having me in your program.
All right, sir. Well, I know some big news. There's serious talk about the vaccine, Pfizer and BioNTech. It's likely to be successful. Well, we already know that there is a measure in place for Ghana. The question I have for you is, what is our rollout plan like?
So, in Guyana, as you know, we are part of the COVAX facility. And COVAX has been assessing a number of these vaccine candidates. And once they're able to determine that their efficacy is high and that these vaccines are safe, they're going to make it part of the COVAX portfolio. So we are going to benefit through that mechanism. In the country, we are setting up a team of people who are more acquainted with vaccines. And we are going to work out, one, the logistics of how to roll this out. Two, to determine the types of vaccines and maybe the conditions under which you have to store, and to ensure that we have the cold chain to be able to appropriately store these vaccines. The two vaccines that have created a lot of excitement, last week you had a vaccine from Pfizer, and that vaccine has been shown to be about 90% efficacy. And what that really means is that they're showing, people who had the vaccine, they're able to develop antibodies and withstand the infection. So that one, however, the challenge would have been, and still is, that you would need refrigerators to store these vaccines at -80. And that's going to pose a challenge because in our cold chain network in Guyana, we don't have such refrigerators. So if we are getting those types of vaccines, it would mean that we have to buy these refrigerators and put that type of infrastructure in place. Today, you would have seen Moderna release their findings of a new vaccine that they've been working on. It's similar to the Pfizer vaccine because it uses mRNA, and but they are showing that it's more effective. So they have released that it's 94.5% effective, which is also very good. The other interesting thing with the Moderna vaccine is that they're saying that if you store at -20, you can keep those vaccines for as long as 6 months. And if you have room temperature, well, not room temperature, but the like fridge and freezers that we normally use at home, then we would be able to store the vaccine in those conditions for 30 days, which is in keeping with our existing cold chain that we have. So that is very hopeful and very optimistic news that you have a vaccine now that we can use with our existing infrastructure. But we'll see because we are getting these vaccines through COVAX, and we'll see what arrangements COVAX would make with these two vaccine companies.
All right. Before I ask you about whether we have funding in terms of storage for the Pfizer vaccine, I actually wanted to ask you about the Moderna one. Now, I'm not sure what company Moderna, which country is coming from. Is it a part of the COVAX mechanism, and would that vaccine be possible for us?
Well, they're both companies, Pfizer and Moderna, they're from the U.S. BioNTech is a German company. So most of these vaccines are being developed jointly with several companies being involved. So in the case of the Pfizer one, it's Pfizer plus BioNTech, which is a German company. I think Moderna and maybe some other partners are developing that Moderna vaccine. So there are combinations of companies that are working on these things.
Okay, so this one can possibly be among the COVAX program.
Yeah, because COVAX, they're constantly evaluating those vaccines that are in phase 3 trials, undergoing the testing, and once they're deemed to be safe and efficacious, then they would bring them on to the COVAX portfolio. So more than likely, I'm sure there would be negotiations with these companies to ensure that these vaccines are part of the portfolio.
All right. And in terms of the Pfizer vaccine, the storage, as you explained to us just now, do we have funding for that particular type of storage?
We would have to review, and I'm sure we will be able to, if it's necessary, we'll be able to buy those refrigerators.
Next question I have for you is, would there be the need for private sector assistance in this particular regard? As you just mentioned, we would need to.
In terms of building out an cold chain, I think the government would have the capacity to be able to do so. But as I said, those refrigerators, we don't have them in country, and we'll have to invest in acquiring them, bringing them into the country, establishing these refrigerator banks, so to speak, and putting them in different regions. And then in between the regional distribution points, to be able to create cold chain using maybe dry ice or some other medium to move it around so that we can immunize people. But these are things that we'll have a technical group review, and we have already started to look at the types of refrigerator, the cost, how to deploy, possibilities if we order, when we can get them in, and so forth. So we have been looking at that over the last couple of days.
Okay. Previously when we spoke, you did mention that we in Ghana, we have a very unique program when it comes to vaccination, and that will be followed somewhat for COVID-19.
There's a little difference though, because we generally are more accustomed to dealing with younger children, and our immunization programs have been very successful because we've been able to have immunization rates in almost all regions above 90-95% in some cases. So we are very good at doing this. The difference, however, with this particular vaccine is that the vulnerable people who would need the vaccine first are one, frontline healthcare workers, other frontline workers, in other categories, and then we'll have to look at older people, people with illnesses such as diabetes and so forth. So it's really an adult population that we're looking at, and sometimes doing immunization program with an adult population can be very tricky.
Okay. And I recall you mentioning that 3% we're going to get first, and then we'll get another percentage after.
So we, so far what COVAX have told us broadly is that we'll get 3% of our population first, and then we'll get another 17%. So our thinking right now is that that first 3% would be used for frontline workers, and then the 17%, when we get that, we will use that for older people and people with comorbidities.
All right. I'm told that through the Indian High Commission that we can also benefit from vaccines manufactured. Let me see if I get this correct. AstraZeneca Pharma? That's it?
Yeah, so that's another company that has been working on vaccine, and they have been working with different countries. So the vaccine, I think, was originally made in the UK, but they have been collaborating with other countries to scale up manufacturing. But that particular vaccine is still in its phase 3 trial, and we haven't got those results as yet. And once we get those results, we'll probably we will be in a better position to make a determination. The Indian government, as I understand, they are going to manufacture a couple billion doses, and so while they would use some of it for their own population, they have set aside a substantial portion of it to distribute to other countries. And I'm very happy to hear that they are considering Guyana as one of those countries that can benefit from this particular vaccine.
All right. Lastly, on the vaccines, if I can recall that earlier when we spoke about Argentina and countries in South America being able to access vaccines once they're developed.
Again, we have had exploratory talks with Argentina, and we'll see again how those arrangements for the vaccine evolves.
Okay, thank you, sir. Now let's get to our update in our region. St. Cuthbert Mission, a lot has happened over the weekend. Could you give us an update?
Well, right now, as of today, we have about 239 cases in St. Cuthbert's Mission, so it went up slightly. We continue to do testing. We have several doctors who are on site. We have been talking to the community. We have been talking to the residents. Those who have tested positive, we have identified them. We have told them to isolate. And we have been working with the village council. So I think all the various elements that we have practiced elsewhere, we have already put in place at St. Cuthbert's Mission, and we're going to continue to monitor them. So as with a lot of these things, we'll see cases go up, then they hit a peak, and then they start coming down once people abide by the measures. And I don't think we have hit the peak as yet, maybe in another day or two. So with more testing, we'll probably see a little bit more cases going up. The good thing, however, is that for most of the cases that we've had in St. Cuthbert Mission so far, what we notice is that they are very mild cases. A lot of them are asymptomatic, meaning they have no signs or symptoms, but we nevertheless are monitoring them. If, however, anyone do develop any signs or symptoms, then we'll bring those persons down to Georgetown Public Hospital. So far, the team on the ground has been paying keen attention to what is happening, and they will continue to do so, and today we'll continue with our testing.
All right. How is our team, though, the medical team, the officers from CDC, how are they faring in this?
We have at least 2 doctors that are permanently resident there, and we have a team of nurses that are currently there. Over the weekend, we have sent in from the Health Emergency Operations Center, we have sent in a team of people to explain how to do sanitization. So they have gone around and they have been talking to people, and they did some amount of sanitization. I don't think they have completed all the household, but they did for some of the households.
All right. From Region 4 over to Region 1, we've had really good news coming out of Cubana, and I noted that Warapoka was one of the other communities that was being looked at. Could you give us an update?
Well, Cubana, you remember at the peak of this this cluster of cases that we had about 62 cases. So today we have 4 cases now, so we have lifted the lockdown. And surrounding communities, we have seen a corresponding decline in cases. However, we, as I said a couple of days ago, we are monitoring a situation in Warapoka, so now we have about 14 cases. And over the weekend, we had a medical team that visited. We continue to do more testing and swabbing. So we'll see whether we have an increase in cases there. Of course, when the medical team visit, They would normally conduct education and talk to people about what is required and give them some guidance on what they need to do to prevent transmission. And so all of that was done in Warapoka. So we'll continue to monitor and see if we can rapidly bring down the cases, or if there's an increase, we'll treat with it accordingly.
Okay. Just for clarification, what is the figure as we speak?
In Quibana, we now have 4 cases. Warapoka, we have 14.
14. Okay, thank you. All right, so as we get ready to wrap up, training. I was told that at Linden, Linden healthcare professionals, they had a humanitarian training with the U.S. Embassy. I know this is just from a long list of other trainings that is currently happening with the ministry. Could you tell us a little bit on that particular training and just a little bit on the others that are ongoing?
So we have a team from the U.S. government that has come to Guyana and working with us. And they would be visiting a number of regional hospitals to do hands-on training with the medical staff of these hospitals. So it would include a broad brief on COVID and the latest development, what is happening with the disease and so forth. And in addition to that would be more practical hands-on training on the use of ventilators. So I think from the feedback, the training went well in Region 10, and we'll see in other regions the team would be going out to those other regions to conduct similar training.
All right, and then there's training that is currently being put together for some of our local doctors.
Yeah, we have training and updating knowledge is an ongoing effort in the ministry. So we'll be doing a session for people managing the more severe and critical cases of COVID. We expect one such training to start in December. We have had the ongoing online training that we have been conducting, teaching people more about ventilatory care. So a number of doctors are enrolled in that. We have currently a training program with the government of Chile, where another set of doctors have been enrolled, and that's completing a whole course dealing with COVID-19. So that course would come to an end on the 20th. Plus, we have started some training with PAHO WHO. They had their first online session on Friday, looking at using WHO guidelines for certification of debt. And the participants now would be required to do an additional set of sessions using the PAHO Virtual University. And when they completed that, they'll have another online session with the experts from Washington, and then they'll be certified. So these are just some examples of the training program that we are doing, but there will be lots of opportunities for training, especially in this area of COVID.
Okay, thank you. I wanted to quickly ask you, on the weekend we observed World Diabetes Day, and I know when we talk about comorbidities with COVID-19 and so on, diabetes is on the list. So can you enlighten us as to what is being done in terms of diabetes in Guyana?
Well, the first thing is that we want to prevent people from getting diabetes. Unfortunately, the International Diabetic Federation a couple of years ago had done an assessment where they think that we have about 60,000 people in Guyana that probably have diabetes. Now, we don't have unregistered those amounts of people, but they suspect that they might be pre-diabetics and persons with the actual disease that are undiagnosed. So it is a major problem in Guyana, and we have to encourage more people to get tested for diabetes to ensure that they're coming forward, going to their health center, understanding what is happening with their condition, and that's something that we want to encourage. There's something called a glycated hemoglobin, which is normally used as the parameter to see whether or not you are diabetic. So we want to encourage people to get tested and to ensure they understand what is their level of glycated hemoglobin in their blood. So that's one. So testing, we have to encourage more people to do that. The second thing is that people, or maybe the first thing, is people ought to pay more attention to their diet. I think most of us, we overeat and we don't do a lot of exercise. So over time, you end up having excess body weight, which is one of the contributing factors to diabetes. So that's something that we'll have to look at more carefully. And we have to embrace more of an active lifestyle. And so we got to encourage more people to be active, to exercise, to play games, and to really monitor what they eat, because that is very important. But having said that, that's more on the preventative side. Having said that, there are persons who already have been diagnosed with diabetes, and they have to take care of themselves. A lot of our diabetic patients, because it's a chronic disease, it takes a long time before you develop complications. People, when they're diagnosed and in the early stages, some people don't pay the kind of attention that they should, and they're not aggressive with their treatment. And because of that, the disease then progresses. And so diabetes can easily damage your kidneys. And in those types of complications, we see an increase in cases of persons who would require dialysis. This can be prevented if you manage your diabetes properly to prevent those complications. Diabetes also causes blindness. And again, if you're a diabetic, you're required to check your retina at least once a year, once every 2 years, to see and to check for changes in the retina and to prevent blindness. Diabetes also affects circulation in your feet. And again, we have known of many cases where, again, people not paying attention. They're not treating their diabetes early enough, they're not controlling it, and these things can lead to amputation. And we have, I'm sure we all know of people who had to get a toe amputated or maybe a leg amputated, again, because of uncontrolled diabetes. All of these complications can be prevented. And again, if we take the precautions, manage ourselves appropriately, eat the right types of diet, I'm sure we can bring this under control. But again, it takes effort. Now, with all that I've just said, this would be the normal run-of-the-mill things that you have to do to work with diabetic patients. But this is now compounded because we are in a situation of the pandemic. And in this particular pandemic, we have noticed that persons with these types of underlying conditions, such as diabetes, are the ones who are more at risk. And we have seen the persons who have been hospitalized, a lot of them have complications of diabetes. And we have also seen that of the persons who have been hospitalized and ended up in the ICU, and some of them who have passed away, that many of them were diabetic or had other conditions such as cancer or heart conditions, respiratory conditions, kidney conditions, and this has compounded the management of these patients. So during this pandemic, it is absolutely essential for diabetics to control their diabetes and to avoid putting themselves at risk for COVID. If they do these two things, I think they'll be able to rally out this pandemic and stay safe until we are able to get that vaccine. where we can immunize them and prevent COVID from happening. But until then, we have to all work together to make sure that we keep people safe.
Yes. Minister, I have a last question. This question is coming from the newsroom. They're asking for an update on the persons that tested positive from the airport. And they're also adding to that apparently some of these persons have been seen at cricket matches and so on, when they should be isolated.
Well, I think so far, since we have opened the airport, we've had about 8 cases where when we did a second test, we identified them as being positive. Those persons have been told in some cases we had to bring them into our institutional isolation so that they can be properly isolated. I'm not aware that persons who have tested positive when they came in at the airport, that they are at cricket matches. If that is happening, that shouldn't happen. And they have been appropriately warned. The surveillance team has been checking on them. I am not aware of the specific complaint that is being made. But if we get that information, we'll certainly track that down to ensure that we don't have such reoccurrences if it has occurred.
Okay, Minister Anthony, thank you so much for speaking with us, for always being accommodating.
Well, thank you very much.
All right. Well, that's it for today's COVID-19 update. We were, of course, speaking to the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and, of course, the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.